Hello guys, welcome to Daily Pathology. I am Dr. Abhishek, and in this video we will learn about peripheral smear examination, all the basics. So let's start the video. So this is the quick memory tip which I created for you guys. This is first we have to scan the smear. Basically at the feather margin we will learn what is feather margin, and then first we will calculate look for RBC, then WBC, platelet, parasite and inclusion, and lastly we will give the impression of the smear. So this is the order you should always follow to while examining the peripheral smear examination, and do not go randomly at the PS. So first we will learn what is the ideal smear. You should always make ideal smear for the peripheral smear examination. So in the image you can see this is the ideal peripheral smear, which is tongue shaped. This is tongue shape, and it has a three parts, which is head, body and tail. Head is the drop zone, body is the distribution zone, and tail is the feathered edge, as I mentioned earlier. So there should be a smooth transition of thickness from head to tail, and in this area we will mention patient details of the patient, like number, PS number, whatever according to your laboratory. Then it should be, then how you have to find this ideal monolayer area, which is at the junction of body and tail, for the calculation of various things in the PS like RBC, WBC, platelets. You should calculate at this ideal monolayer area. So first here you can see these are the features of ideal blood smear. It should be tongue shaped, smooth feathered edge, covers the 2/3 and 3/4 area of the slide. In the image you can see, then straight parallel lateral margins, uniform thickness, gradually tapering towards the tail, well formed streak free feathered edge. There should be no streak, no holes, vacuoles, ridges. So you should always clean slide properly before making the PS. Then no cell distortion or crushing artifacts. Then clean background should be there. There should be no precipitate or contaminants that will obscure the results. Then well stained smear, RBC appreciate you can see as a pink to slightly orange. WBC should have crisp chromatin, cytoplasmic granules very clearly visible, and platelet should be clearly visible. So ideal monolayer characteristics are RBC are evenly distributed at that area. So you should find that area. Cells barely touch but do not overlap. So here you can see these are barely touching each other but do not overlap, like this. If the RBCs are overlapping like this, then you should not calculate at that area. Central pallor occupies, you can appreciate that. WBC morphology should be well preserved, and this area is located just behind the feathered edge and preferred region for differential leukocyte and morphology assessment. So this is very important point. Next we will go towards the stepwise how to examine the peripheral smear. First step is scan at low power, that is the 10x. Purpose of this is get overall picture before zooming into the smear. What you should look for on the scanner is look for the smear quality, that it should be well good smear to interpret or not. Very important before examining. If it is a bad smear, then don't calculate further. Look for distribution of cells, feather edge, clumps, rouleau formation, large abnormal cells and platelet clumps. So here you can see the feathered edge, good distribution and no clumps. So you should scan on scanner view, you can see image like this. And tip for you guys is never start directly on oil immersion field, that is 100x. Always start from scanner and then eventually go towards the oil immersion. Next step is examine the feather edge. Important findings are accumulated here. That's why it is very important. Always look for platelet clumps if any, blasts, large atypical lymphocyte, parasite, microfilaria, nucleated RBCs. So common findings which are seen at feathered edge or at the tail end is platelet clumps, blast, atypical lymphocyte, microfilaria, which are usually just lie there at the end region. So you should must focus on that. Next are nucleated RBCs. Always remember scan feather edge before moving to the detail in smear. Third step is the RBC morphology. So after examining the feather edge, you should go on the 40x lens. So you can see most diagnosis begins here. So for first we will examine the size of RBC. So it could be microcytic, normocytic, macrocytic. So how should we differentiate that RBC is normocytic, microcytic or macrocytic? So for this, always compare the RBC with nucleus of small lymphocyte. So first you have to find out the small lymphocyte in the PS. Always remember, don't go for the large lymphocyte, always go for the small lymphocyte. So I will enumerate the features further ahead in the video. Stay tuned. So after finding out the small lymphocyte, if the size of nucleus is equal to the RBC size, then it is normocyte. If the size of RBC is less than the size of this nucleus, then it is a microcyte, and if the size is larger than this nucleus, then we call it as a macrocyte. So that's how you should categorize as the RBC. Then next is the chromia. Chromia is second important feature. So it could be normochromic or hypochromic. Then in hypochromia there are again four categorization: 1, 2, 3, 4: mild, moderate, marked and severe. So pallor, depending on the RBC pallor you should grade. We will see it in the next video how to categorize it. Then color, as I mentioned, normochromic, hypochromic. Polychromasia means immature RBC, when these are the represented as a bluish tinge to the RBC. So you can say it as a immature RBC in the PS. Then next is the shape, that is poikilocytosis. These are the various shapes. These are the spirocyte, schistocyte, target cell, sickle cell, elliptocyte, teardrop cell, acanthocytes and Burr cells. So whenever you can see these shape, you should mention this in the PS according to that order. But always remember, it is very important to mention as AC or APK, that is anisocytosis and anisopoikilocytosis. This means change in size, this means change in size as well as shape. Always remember this. Next is the arrangement. If there any rouleau formation, you should mention this. Agglutination means basically there is a clumping of RBC, and rouleau formation means there is a stack coin like appearance of RBC. So this also helps in diagnosis of various conditions. Then next is inclusions. If there any in RBC like Howell-Jody bodies, which are commonly seen, basophilic stippling, Pappenhammer bodies and Hens bodies. So if these are inclusions are present, then you should always mention in this in your report. So ask yourself what story these RBC are telling. This is the importance of this RBC morphology examination. So next we will go to WBC, white blood cells. So first estimate total WBC count, that is TLC, total leukocyte count. I will giving the formula for calculating that. So then evaluate the differential count. So TLC first, then DLC next. Look for toxic granulation if any, shift to left, hypersegmented neutrophil, reactive lymphocyte if any, blast if present or not, smudge cells and or rods. So let's see one by one how to identify various white blood cells on microscopic examination. First, we will go from neutrophil. This is a granulocyte. Size is 10 to 15 micrometer. This is a multi-lobed nucleus, that is 2 to 5 lobes can be there, and which these are attached by these strands. So these are the attached nuclear lobe, you can see in the image. And then it has a pink color fine pale lily granules. So these are the granules which you can see, which are pink in color. So that's how you should identify the neutrophils. There is a criteria for a hypersegmented neutrophil which will be seen in the next video. Then next cell is the eosinophil. For eosinophil, size is 10 to 15 micrometer, which is approximately similar to the neutrophil, which identified by this bilobed nucleus, which is also called as spectacle nucleus, is like a spectacle. And more important is orange red granules. Here you can see orange red granules in the cell, which are large and coarse. Here these granules are fine granules, here large and coarse granules. You can see in the image, these are the large and coarse granules. So that's how you identify the eosinophil. Next cell is the basophil in the line, which is of approximately 10 to 14 micrometer. And how you should identify, it has a coarse dark purple granules which obscure the nucleus. So look at this cell, guys. You are not able to appreciate the nucleus. Usually it has a bilobe nucleus, but you cannot appreciate because of these coarse dark purple granules. That's how you should identify basophil. Next cell is the lymphocyte, very important. As I said earlier, small lymphocyte is used for RBC size comparison. The nucleus. Small lymphocyte is of size 7 to 10 micrometer. How should you identify the small lymphocyte? It is obviously, as the name says, smallest cell, NWBC, a round, dense and dark nucleus. So here look at this image. This is round, dense and dark nucleus, and in the periphery it has a scant sky blue cytoplasm. Large lymphocyte is 10 to 15 micrometer. Round, slightly indented nucleus can be seen, and more cytoplasm compared to small lymphocyte. Here the cytoplasm is pale blue in color. Next cell is monocyte, also one of important cell. So in monocyte, the largest cell of the PS, that is 15 to 20 micrometer, and it has a kidney or bean shaped nucleus. Here you can see this is the kidney or bean shaped nucleus. Lacy chromatin, this is the lacy chromatin. Abundant grey blue ground glass cytoplasm. Here you can see this is the abundant cytoplasm, and cell has a irregular margins and also can be contain vacuoles. Also important, one of important identifying feature. So vacuoles can be present or not, but is a feature for identifying monocyte. So that's how you should identify these cells in the peripheral smear for the differential leukocyte count. So next we will see how to manually calculate total leukocyte count on peripheral blood smear. So this is your ideal smear, and how should you first find out this area? As I said, this is the monolayer area where RBC are just touching each other or close to each other. So after finding out that area under the microscope, so this is the pattern you should follow. First count at this area, then this. So this is how you should go. This is the zigzag pattern, so it helps to avoid any loss of any area. and cover majority of portion of PS for the WBC count. So use objective lens, that is 40x lens, high power field. Then count 10 consecutive fields as I mentioned in zigzag pattern. So this is the field 1, this is the field 2, this is 3, 4, 5, 6, 7, like this. You should calculate 10 consecutive fields and then count the WBC in each field, calculate the average number and multiply it by 2000, which is a approximate conversion factor. Important, remember this 2000, you should multiply it by 2000, which is a conversion factor. So here we take an example for your understanding. WBC is counted in 10 high power fields, so approximately you get a 45 WBC. Like in first field you get 4, then second 3, then next field you get 4 again. So that's how total in 10 field you get a 45 WBCs. Then this is the formula, you should mug up this formula for manual calculation. And these are your calculated WBC, that is 45. These are the 10 high power field as I mentioned earlier. We calculate 10 high power field now, so this is 10 and multiplied by 2000. So total WBC count is 9000. So this is your total leukocyte count. That's how you calculate the total leukocyte count manually. And differential leukocyte count, you should know these important points for identification, and according to that on your cell manual counter you should calculate the 100 cells. Next is platelets. So platelets, you should assess the adequacy of the platelet, very important. It is adequate or depleted on the smear studied. Then is there any large platelet or giant platelets? Is there any platelet clumps or platelet satellitism? Platelet clumping can falsely lower the automated platelet count. So adequate or not, decreased giant platelet clumps or platelet satellitism. These can be large small platelet clumps or large platelet clumps if you see on the smear, and on counter it is saying if low platelet count, and then you can examine the smear and should comment the platelets are adequate or not, which is very important. Then manual platelet count, how should you manually calculate the platelet? So under oil immersion lens, that is 100x, count the platelet in 10 fields, calculate the average per field platelets and multiply it by 20,000. So remember this factor and you will get a rough estimate of platelet count. This is the crude method for calculating manual platelet count whenever there is unavailability of automated cell counters, or if you want to calculate and correlate with the automated cell counters, you can calculate manual platelet count. Next step is the look for parasite inclusion. So after platelet, don't just report it out, always look for hemoparasites. So never finishes smear without searching for malarial parasite, microfilaria, babesia whenever there is relevant, hemophagocyte, nucleated RBC, abnormal ingredients, that's RBC cells. We will learn this in further video ahead. So this will completely change the diagnosis if there is any hemoparasite. And last but not least, give final impression. In final impression, don't just stop at describing the morphology. Combine the CBC, that is complete blood count on automated cell counter, and peripheral smear finding, and give the impression. Examples are, if you see microcytic hypochromic RBC and anisopoikilocytosis, then give it as a suggestive of iron deficiency anemia. Microcytic anemia with hypersegmented neutrophil, then you can give suggestive of megaloblastic anemia. Leukocytosis with blast, then suspicious for acute leukemia. Always correlate with the clinical history, also very important. Normocytic normochromic with histiocytis, then you can go for microangiopatic hemolytic anemia. So this is very important, always correlate with clinical findings and clinical history of patient and the CBC from the automated counter. Thank you.